If you want to leave a long-lasting impressions and have patients remember you as the best physical therapist of all time, then you need to tune into this episode. Hi everyone, welcome back to the podcast. Welcome all new listeners and welcome back to those who have heard my content in the past. Before I go on to the podcast, which is going to be a phenomenal one, those of you who have heard my podcast over the last few months, years, this is going to be an important one for you. What is new and what's better in life? I just got back from a self-development leadership conference in Florida. You guys have known through the podcast, last month I was in Florida in Orlando for a Disney cruise. Last week I was in Maryland for the private practice section annual conference, and this week I was in Orlando for a leadership self-development conference and business. So the title and everything that we're doing today in the podcast is really going to be about everything I learned, and I'm coming in with fire, and I want to change the planet, and I want to be able to help physical therapists just like yourself change their mindset, help you figure out what it is that you need to do to separate yourself from everyone else, whether you're in cash, in network, out of network, it really doesn't matter. We're all trying to do the same thing. So that is the update from last week. And I have my kids are doing great. It's good to have them back. I was away. I've been traveling quite a bit, and people ask, how do you manage to travel so much? I think to date I am at 48 flights this year, and so that's nearly one a week. And I travel quite a bit for personal development, business development, and leadership. One, so I can be a great, phenomenal father, that I can be a great leader inside the business, and then also just to be able to grow my team, my staff, and the people I serve. And that might seem easy, and you're treating people right now and you're thinking, gosh, this is so easy. How does anyone mess this up? Or you're struggling with that. What you seem to find is the minute that you start adding another person into your world, like a staff member or somebody close in your relationships or whatever it is, you realize, like, why can't you just do it like me? It's so simple. I've been able to do it. Why can't you? And that's deeper. There's a deep challenge behind all of that. And so really today I chose this topic because I think that there's a lot of patients that you serve that for some reason they seem to stick with you, or you're struggling and you can't figure out why you can't keep a patient. And I'm going to dive deep into this one. This is going to be important for you to be able to acknowledge and figure out what it is that separates you from your peers and everything else. And I'm not talking about the clinical skills. I'm not talking about anything other than what makes you special and what keeps people coming back. And I'm going to share this. I'm going to share one thing that you need to absolutely do to help you realize what it is that separates you from everyone else, and truly helping you figure this out. And when you look at your patient load this week and next week, you're going to look at your schedule and be like, gosh, these people do love me because of this, or they don't stay because of this. So I'll work through that. But there's a deeper meaning behind all this. And, I really think that, today's podcast will help you tremendously. No matter what setting you're in, if you're ortho sports, or you're in PT school, or you're a clinician burnt out from business and you're trying to figure out what the next step is, this episode is going to be perfect for you. So here we go. What is, the number one thing to help people coming back? Before I do that, let me share. I got to listen to an NFL Hall of Fame quarterback, and he was telling this story. His name is Jim Kelly. And Jim Kelly is, if you guys don't know who he is, he's a pro football quarterback, and it was about his story and his claim to fame. A lot of people remember him and his team because he went to the Super Bowl with the Buffalo Bills 4 times. He went to the Super Bowl 4 times and lost all 4 times. And that's not easy to do, but it's not easy to overcome. And he really wanted to kind of convey that message. And behind the story, for those of you who know, my father-in-law had some challenges with cancer, and he struggled with a couple things in his jaw and his face. And he's a personal mentor to me. He's an incredible human. And to see somebody go through that, it's not easy. And for them to face that, well, Jim Kelly also had it in his jaw. He had jaw cancer, and so really resonated with me. And he said he had 4 bouts of really hard chemotherapy and 4 bouts of cancer where it came out of remission. And so he's like, not only did I lose four Super Bowls, but I also lost. I went into battle 4 times with cancer, and I beat both of those to overcome that and come back from it. You and I can agree that's pretty admirable. It's pretty incredible, and I think there's a lot of lessons behind that. It's not just about you just push hard, just work hard. I think there's a deeper meaning behind it. And he said, there's a couple things that you need to remember, and how to create a legacy for yourself. And he said there's 4 main things for him, and I'm going to describe those. He said faith, family, fun, and the fans he had, right? Basically, that was his ecosystem. And as he went along, there's another motivational speaker who talked about that we all know what wealth is, right? We know what having money is and having wealth. One is immediate, short term, and wealth is about long term things that you're going to be leaving to your kids, your spouse. So we're talking about real estate. You're talking about anything else that you would leave behind for them. And he said it a very important way. I think it hit me, and I want to share it with you. True wealth, happiness, long term wealth is what you leave behind when you remove all the possessions. Let me say it again. True wealth is about what you leave behind when you remove all the possessions. That means no house, no car, no financial portfolio, nothing about anything that is tangible that you're going to leave behind. It's the intangible. So then he asked, what are you going to leave behind? What does that look like? What do you want to be remembered as? And then I thought, it's funny because we as a profession, we're always working with patients. And you may work with that same patient and say, I'm going to mobilize this person. I'm going to stretch this person. I'm going to do McKenzie exercises to this person. And another PT who uses those same battery of skills doesn't leave such a big impression on them. And you have to realize that there's a big difference between the two. What if you did the same exercises, the same style of clinic, same music, same experience, but that patient didn't get the same results than the other person? Let's frame it as the same exact experience. What changed? Clearly, one PT created a different experience. I'm going to share a data point, and this is something I'm sharing with my team personally right now too. There's a study, and you can look this up. There's a concept called the 7-38-55 rule. And it was researchers from UCLA on behavioral psychology and how emotions are created. If you and I were in a conversation, they basically broke it down. They said 7% of what you do, how you create emotion with somebody, are based on the words that you use. So only 7%. So I'm talking to you right now, but only 7% is what actually creates emotion. They said 35% is the tone that you use, and 55% is the body language. So what that does is it helps consolidate. Well, when you're working with a patient in front to help them, to show them, to gain buy-in, to help them understand what you do for them, those 3 points are what create the emotion or experience that you're going to help them. So the words you use are only 7% of the total equation. 35% is your tone, and 55% is your body language. So the person who gets great results using a very similar framework, they use the McKenzie mobilization and stretch. Same treatment table, same environment, but one person's going to be just a little bit better. And that's based on the tone and the body language that they use. So there's something different about what you do. And then ultimately, my big question is, when all those things were removed, they went to discharge, they got better. And in 4, 6, 8, 12 months from now, 2, 3 years from now, what is it that you want that patient to remember about you as a clinician? How did you help them more than any other clinician? Meaning, you specialize in getting people out of pain. We know that. But so does every other physical therapist. Well, I can get them out of pain faster. Great. What are they going to remember in 2 to 3 years? Is it that you got them out of pain faster? Or you gave them the quality of life that they wanted? And that concept is not something that's understood. That's trained and reminded to the patient. What I mean by that is, You might work with patients and they might say, I have low back pain. Great, you get rid of the back pain and they can go do their daily life. But when you put it in terms of what is it that this back pain is limiting you from? Is it playing with your kids? Is it being able to go skiing with your spouse? Is it about the dream Europe backpacking trip that you want to be able to do? So instead of focusing on, I need to get this person out of pain fast, and I can get you that back pain fast, you're not talking to that patient about that. What you should be saying is, we're going to get this back pain under control so you can get back to that Europe backpacking trip. They're going to remember your legacy when removed. All the exercises that you do, all the ultrasound, all the modalities, all the blood flow restriction, all those things are a means to an end. And you might have the greatest technology, the latest equipment, but the patient doesn't care about that. And you focus in on, you hone in, and that's probably what you're offering and selling to the patient. We have the latest technology, we have all these things. But if you don't understand what the main purpose is, the legacy that you're about to leave, you want to be the PT who helped this person backpack through Europe in their dream vacation with their spouse. The one thing they always wanted to do in their life. That's the legacy. So for you, if you're sticking to back pain relief, tight hamstrings, poor core, limited posterior capsule, elevated right scap, winging when you raise your arm, those are all small, insignificant things to the patient. Because every PT can do that. Every PT can fix the winging scapula. Every PT can mobilize the hip. But not every PT can get that patient to backpacking pain-free in Europe, knowing it was the one thing they always wanted to do. And so for you, if you're thinking about how do I make myself different than everybody else, you have to understand that the legacy you leave, just as that person phrased it, when all possessions are removed, what's the legacy that you'll leave? And the legacy you leave with that patient is, what did you do for them in their life? What did you give them? What's the one thing you gave them that nobody else did? I gave them freedom from pain. I gave them the opportunity to go backpack without reservation. I gave them the opportunity to play with their kids again. That's the wealth that you bring to your patient population. And if you don't understand that, you'll just be like every other physical therapist. Focusing in on the goniometer, focusing on the hamstring length, focusing on external, internal range of motion, which is templated, which is what everyone else does. Patients don't remember that. Patients don't remember the green TheraBand or the yellow TheraBand. What they do is they remember the tone, the body language that you used, the belief that you gave them that it's possible. Not the degrees of range of motion that they've improved. That's irrelevant. It was a means to an end to help them get somewhere. But that's not just understood. You have to share it. You have to document it with them. You're this much closer to backpacking. You're 75% of the way there. That's the way you frame that. And that's the legacy you leave, because they're always obsessing about, gosh, I'm so close to backpacking. I'm only 75%. So when their spouse says, how did physical therapy go? If they're probably seeing you right now, they're probably saying, they said my hamstrings are getting, my flexibility is improving. That's not legacy driven. Legacy driven is, I'm 75% of the way to get to backpacking. Can you believe that, honey? I'm so excited. We're almost there. What does that do? Now that partner is like thinking about, gosh, that's a great physical therapist. I love that. Keep going to it. But improving flexibility doesn't put it in context of, how am I improving this patient's health and wealth for the long time? So when you are working with patients, I want you to just take a step back. On previous episodes, I've shared this. You have to figure out why people have their discomfort. Why they're looking to improve their back pain. Because we all walk around with it. The challenge is some people want to make an immediate effect. Some don't. Because it's not limiting them enough. What is it limiting it from? That's the legacy you'll do. That's the physical therapist that helped me lose 10 pounds so I can feel good about myself for my wedding. That's the physical therapist who allowed me to play with my grandkids. That's a physical therapist who helped me use a suitcase that I couldn't pull before to be able to go on my dream cruise or whatever it is. And I think if you put in context there, that's the legacy that they'll remember. So remove all the possessions, all the technology, all the things that you pride yourself on, that you think it separates you from everyone else. Well, I'm Mulligan certified, I'm whatever it is technique. Those are all irrelevant. That's not the thing that helps the patient. It might help them on the pain side, but how does that apply to their life? And that's for you to help them understand. But first, you have to be able to understand. And here's the interesting part. Even if you say it, if you don't believe it, it won't transfer. Why? Because we talked about this. 7% of creating emotion and help people understand is only 7% is tone. 7% is words, 35% is your tone, and 55% is your body language. Well, how do you improve your tone and your body language? You got to believe what you're doing. You got to feel that. And so the only way to be successful and leave this legacy is feel it. You have to have the tone, you have to have the body language to create that buy-in, to create that emotion. And if you don't have that, well, you're just like every other physical therapist. There's a concept that we have, I haven't shared with you on all the episodes, but there's different type of personality types. And one of them is an analytic. This person has they question everything. They have a lot of logic. They don't like a lot of emotion. They don't like confrontation. And physical therapists, by and large, are analytics. And the only way to win over an analytic is data, right? You got to show them how things work, and this is kind of the plan, and those type of things. Now, tone is very important because you're showing confidence. Body language also just reinforces it, and words with analytics are very important. However, just because you receive and give information that way doesn't mean they do. And so ultimately, if you find somebody who doesn't believe you, they're analytic, they're a little bit more of aggressive personality type, all those things are irrelevant if you can't understand the message that you're trying to convey and what you can do for them. And if you can't do that, you'll never leave your legacy with these patients. So if you want to separate yourself from every other person, whether you're 2 years in, you're a new grad, or you're 20 years in, these are all key components to help separate you from everybody else, to help you understand that you're different. How are you different? For many of you, you might listen to my podcast because it is different. I have a different tone. I have a different body language. I'm using different words than you're used to. For the same reason, patients, they're attracted to that. That's a little different. This person's leaving a legacy. They're making me think a little different. It wasn't about my tight hamstrings. They wanted to work on my total step count throughout the week. They were really worried about what I do at home, how I pick up my kids, how I pick up my grandkids. They even practiced with me on how to bring the suitcase through the airport. They were really trying to make an impact. And if you can't understand that, you'll be stuck in the hamster wheel of more mobilizations, more CEUs, more tactical skills that are irrelevant, because your tactical skills, the skills that you do in the clinic, don't improve your body language or tone. The only way you improve the two most important things is the confidence that you know you're pointing this person in the right direction. And the only way you gain confidence is you're aware of what you're doing for them. And if you're not truly aware of what you're doing for them, you're just using words that don't resonate with them, and that's why I don't believe you. They'll stay with you for pain relief, but they won't stay with you for more. So if you're really wanting to improve your schedule, gain patients for a long term, improve their life, improve their health, improve everything down the line, and you want to have a long-lasting effect, not just the traditional APTA insurance style care of wham bam, 6 and out, 6 sessions, 12 sessions. This is an approach that's missing from where you're at right now. And it's very simple. It comes from self-belief and awareness of what you're doing for that patient, how to make that long-lasting impression, and then insert what you're currently doing within that. You do that, it will be game-changing for your path. And I can tell you that honestly, I've been able to scale to 3 locations, cash-based practice, or 15 staff, and it came down to this, is understanding what people need and want. And if you can do this, it'll also be game-changing for you in the direction you want to go. So I hope this helps. And if you are looking for more information on how to do this, well, Chris, I'm stuck. It doesn't seem like it's that easy for me. I question myself. You might have some inner belief challenges of, what you really do for patients. Like I'm interested, but I just don't buy in. I don't know if we really do that. I'm just going to stick with my mobilizations and keep me happy. Well, the problem is that most people find this podcast and they stay on the podcast because it is different, and you are looking for something different, and you're probably stuck doing the same things, and you're like, this can't be the end of my career path. This can't be the same thing I do. I just stretch people, I mobilize, I give the same 72 exercises to the same 72 patients. There's more than that, and I think that you can do more of it. And the problem is you're stuck inside not just a system, an external system like a hospital system or outpatient clinic, but your own system, your own hardwiring of what you do. And you have to rewire that. And that takes a little bit of understanding of what you do for people, and that'll help you get to that next level. So if you're interested, one of the next things that I'm hosting is my Sports PT Kickstarter course. This is gonna be an online mentorship course for physical therapists like yourself who are interested in sports PT, cash-based, ortho style, to be able to help patients be more active, be more healthy. You can find more on my website, drchrisgarcia.com/Kickstarter. That will be, whenever you're listening to this replay, it'll be in January, I think, January 2025. It is the 15th through March 10th. You can find more information on the website, but ultimately it's 8 weeks of me supporting you through that process, going through on-the-field coverage, in-clinic coverage, strength and conditioning, wellness programs, so you can help somebody understand how you can help them from as early as the field or the gym, all the way through into building programs for them, wellness programs, and they stay healthy, active, and truly understand how you leave a legacy inside their health. So there you have it. That is the one way to create long-lasting, long-term results and make an amazing impression on the people you serve. So I hope you can get that into your practice as soon as today. I will see you guys on the next episode. Take care. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on treating cash pay patients, becoming that expert in your community, and thriving in business. Thanks, and I'll see you soon.